and had played football all 4 years at PLU. So was quite the athlete. But he wanted to come home. And so I said, hey, I'd like to talk to him. So we met at the hospital. And he was a little concerned that I would be meeting him at a hospital restaurant. And of course, I knew all about the hospital. It was a great place to go eat breakfast, but he didn't. So he was a little concerned. But anyway, I brought my kids. We said, hey, we think you'd be a great financial advisor. And he has been a great financial advisor. So it's a pleasure to partner with Connor. And Connor, when they asked us about presenting this, I said, Connor does such a great job. He's a better looking guy, and he's also a lot thinner. So we wanted to have him up here to present this new payroll tax that everybody in the state will have to pay if they're a W-2 employee. So I'd just like to ask you to help me welcome Connor Cummings, who's got the Edward Jones office on the other end of town. I call that the rich side of town. Thank you, Connor.
So I believe that handout and another one was given to you guys via email before the meeting. I'm sure only maybe 2 of you looked at that, but no problem. I've got some physical handouts that will help with our conversation today. Say again? Oh, yeah, sure. No problem. All right, let's get started here. First of all, I wanted to thank everybody for inviting me to come down. It's nice to get out of the office, get in front of people again, take the mask off, be a part of the community and be part of Rotary today. So thanks for having me. Also, I wanted to thank the Centennial for putting on a great meal. It's fantastic and happy that they're still in business and thriving down here in downtown as well. So a couple of talking points for our conversation today. Obviously, you guys had me come on to talk about this Washington State long-term care tax. So we're going to talk about what is long-term care, why is this such a hot topic right now for individuals and employers, employees, and what can you do about it? What are your choices? What are your options? So a little background about what long-term care is. It's for those who need assistance with basic activities of daily living. That would include eating, dressing, bathing, toileting, continence, transferring, and for some of those individuals, cognitive impairment would fall into that category as well. Now, usually this impacts older groups of people in retirement. 40% of the people over the age of 65 will receive some kind of paid in-home care, and about 30% of the population will receive some kind of nursing home care in their lifetime. Now, for a lot of us, we might think, okay, doesn't our traditional health care insurance cover that? No, it's not covered by Medicare. Traditional healthcare insurance does not cover that, even though this might be the most expensive type of medical coverage in someone's lifetime, but it's not covered by traditional medical insurance. Now, of course, this type of care can come in many forms: at home, assisted living facility, adult daycare, nursing home, with varying degrees of care and costs. And I know this isn't super exciting or happy to talk about, but it is what it is. According to Genworth, a company, the Genworth company that does research about care costs and also offers long-term care insurance packages, the median cost for in-home care in the Arlington area is going to be, right now is about $6,000 per month, and for a private room, about $12,000 per month. So like I said, it's not a low cost type of care. This is more expensive long-term care coverage. Now, let's talk about why this is such a hot topic right now. Why are we talking about this today? Why is this an important topic? Well, there's a new tax bill, 1087, introduced in 2019 that passed, that will be taking into effect January of next year, January 2022. Now, this tax creates a publicly funded long-term care benefit for Washingtonians that provides a basic level of protection. Now, so far, we are the only state in the United States that passed something like this. This is relatively new. We're kind of learning as we go. As a state, this is nothing that we took from anybody else or any other state. So right now, it's a payroll tax. It'll be impacting every W-2 employee. So if you have W-2 income, if you're just a normal employee, this will be impacting you. If you are a business owner, you can opt in to this tax. We'll talk about why or why not you might want to do that. But essentially, for the basic individual W-2 employees, will have that immediate impact. That tax will be $5.80 per thousand with no cap. So as an example, if you make $100,000 a year, that's going to be a $580 tax for that year. Now, if you make $10,000, it's only going to be 58 bucks. But you guys get the idea that the more you make, the more expensive it will be. Because it is potentially already underfunded, and we also as a state voted that we cannot invest these funds from this tax, they're already talking about raising the cost. So this is the baseline as what it is right now, that $5.80 per thousand, with the chance that it could increase in the future, or reducing the benefits, which I'll talk about here in just a minute. So the benefits, what do you get for this tax? So someone says, hey, I'm opting in, I'm paying this tax. What do I get for something like this? Well, the maximum lifetime benefit is $36,500, and that can be covered for long-term care coverage. There's a maximum $100 per day. And again, that lifetime benefit is $36,500. Right now, they have it currently adjusted for inflation. We'll see, like any state government program, we'll see how they adjust for that, but that's what they currently have written in now. And just to give you an idea, what does that get you? That gets you about 3 months of a private room in Arlington's current cost as of today. So it's not a lot, it's something. And really why they're implementing this is to help alleviate the usage of Medicaid, which is also an underfunded program right now. So Washington's coming in and offering another type of assistance to cover, again, these more expensive long-term care costs. So let's talk a little bit more about what does it take to be vested in this plan, right? Because not everybody's going to be immediately vested. So if you pay the tax for 3 of the past 6 years from the date of application for benefits are made, you are vested. Now, an example would be, let's say someone starts paying into the program now, 6 years from now, they need ongoing care. They could potentially receive some benefits from the state. Now, where the majority of us are going to fall into is more that 10-year rule. And that 10 rule is that if you pay the tax for 10 years without a break of more than 5 years, you would be vested as well. So another example would be, let's say you're working, you've paid into it for 3 or 4 years, you become unemployed for a period of time, but then you get back into the system, you would still be vested as long as you've paid into it 5 of those 10 years. Now, also to be vested, you must be a resident of Washington. So if you leave Washington state after paying these taxes, these benefits do not get to go with you. So if you go to Oregon, if you go to Idaho, if you go somewhere outside of the country and you need ongoing care, you want to cash in on your tax dollars, it is not available. You have to be a resident of Washington state. Also, you have to qualify for care coverage, which is a little bit different than your traditional long-term care that I mentioned earlier. Like I said, typically to get coverage, you must not be able to do 2 of those 6 activities of daily living that I mentioned before. For Washington state, they make it a little bit more robust. There's actually 10 activities of daily living. And if you need assistance for 3 of them, then you would get potential coverage. And those activities that they put in their program is medication management, personal hygiene, body care, eating, toileting, bathing, transfer assistance, so being able to move on your own, mobility, and dressing and cognitive impairments. So those are those 10 activities of daily living. And if you can't do 3 on your own, then you could possibly get some kind of coverage from the state. So some of the questions people are probably have in their mind is what are your options? What can we do about this tax? Well, your first choice is do absolutely nothing. You are officially going to be opted in January of next year, and you will just see that additional tax line item next to your FICA taxes. And of course, you'll be opting in to that program. You could leave Washington State. You say, hey, I don't want to pay these taxes anymore. These are crazy. I'm getting out of here. That's another option. Or you could stop working altogether and retire, right? Say, hey, I'm just opting out. That would be an option too. Now, for the most of us, those aren't really choices that we have. We can't just get up and leave. We can't just stop working. What are some other options that are available? Well, you could create your own private long-term care plan, and you must have that in place by November 1st of this year. Now, before I had this this presentation today and earlier this year, there's been changes with this program. The deadline used to be July 24th. That might ring some bells for you guys out there. It has now since been moved to November 1st. So that means if you have your own private long-term care plan that meets the exemption requirements for Washington State, you could check a box, fill out an attestation form with your employer and file that with the state and be exempt from having to pay that tax come January of next year. Now, there is some talk about people maybe trying to find some kind of loophole where they say, I'm going to get my own plan. I'm going to get it before November. And then come January, February of next year, I'm just going to cancel my plan and jump through that loophole of not having to pay that tax after I've opted out. There is no formal process right now of the state of being able to close that loophole, but they are talking about that being a possibility of people proving that they have some kind of plan for their own benefits each year. It's not in place right now, but it's something that could come up later down the road. And for me, in my position, I don't want to give that kind of advice. Hey, go get this plan, cancel it, and then have it come back and bite you in the butt, 3 years later where they're looking for back taxes. That would be some poor planning on my part. But again, people are looking at that as an option. I wouldn't necessarily recommend that at this time. Also, you can take these benefits wherever you go. If you have your private plan, you could take this wherever you go, anywhere. So again, unlike Washington State, you have to be a resident to receive those benefits. If you decide to opt out, get your own plan, you can take that wherever you decide to go, retire, etc. And then lastly, with how the plan is set up right now, I understand the spirit of it. I understand the potential financial impact it will probably have on more of your lower income families and households. But for us that are in the medium to upper class, getting your own plan would allow you to make more of a significant impact for your own care, for yourself, and of course, your family too. So those would be the reasons why someone would get their own private package versus opting in with the state. And so that was basically kind of the highlights and the lowlights of the plan, everything I had for you guys today as far as the details are concerned. I'm sure you guys have some questions, so I'm happy to answer some. We've got some time here.
Well, let me ask one question.
Yeah.
Who in their right mind came up with this?
I think Jay Inslee was a big spearhead of this. He was taking a lot of credit for that. Yeah. I don't know exactly who was in charge of pushing that through at the very end, but
so
yeah.
who's able to sell you their plans? I get inquiries from people wanting to sell me the plan, like 20 a week, and they're like, have you done this? Like, who are the people that are now selling this? Is this any insurance company, or it's Edward Jones? Is this a product they're offering now, or?
Yeah, good question. So the long-term care landscape, the long-term care insurance landscape has changed quite a bit since I've been in the industry, since John, of course, since he's been in the industry. So up until recently, there was a lot of insurance providers that could sell you some kind of benefit, some kind of private long-term care package. Nowadays, your options are pretty limited, and there's not a lot of insurance agents that are selling this right now. I just had a conversation with Jim. It's not a product that he's offering right now. So you would either have to go to an insurance company directly, like Lincoln or Hartford or Pacific Life, or most likely you'd get this solution through a broker or a financial advisor. So someone like myself or John, we would be licensed to sell a product like this. Yeah. I will say this too, that a private long-term care package plan isn't for everybody. It's got to make financial sense. For a lot of us that are older, those premiums are going to be more expensive than the tax. So if someone's just saying, hey, give me the lowest cost option so I can check the box and not give my tax dollars to Washington State, for our older people, and I would say age 45 and older, the premiums on a private package that's going to make a meaningful difference for you are going to be more expensive than what that tax might be. Now, again, a lot of that depends on your income status, but I'd say just for the average person, that's where that would be.
So Connor,
Yeah.
what happens if you start the state plan and then you move out of state?
You don't get a benefit. So let's say someone starts paying their tax dollars. They've been living here for 30 years. So let's just take myself, for example. I plan on being in Arlington for, the majority of my life, but I say, at retirement, I want to retire in Idaho. I want to go to the east side or Montana or something like that. Those tax dollars do not come with me. So that benefit does not follow me wherever I go. So in order to receive those benefits of those tax dollars that I've put into that program for my lifetime, I would have to stay in Washington State to receive those benefits. Assuming I need long-term care insurance.
So
That would be
essentially,
another advantage to having your own plan, as if you moved out of state, the plan would go with you.
That's right. Yeah. So with these private plans, something that would be specific to you, doesn't matter where you go, this would follow you no matter what. Good question.
so essentially they're taking money out of your payroll. And then if you move out of state, you're getting, I mean, that's wrong. That's totally not acceptable.
Yeah. Like I said, I understand the spirit of the law, but
Let's hear it for Paul.
yeah.
Now,
Thanks, Paul.
Do I understand that it's 36.5 maximum benefit? That's not per year?
That's right. That's a maximum lifetime benefit, regardless of what you put into it.
Of
So like I
36.5?
Yeah. It gives you basically 3 months. So like I said, this is really going to make a large financial impact potentially on your lower income households. For anybody that's, median income, higher income, you're paying a lot and you're not really getting anything for it. Now, unlike Social Security, where everyone's paying into it, depending on your income, you're going to pay more, but your retirement benefit can be varying based on how much you put in there. Of course, up to a maximum. Now, this program is not like that. Here's the set limit. This is what you get, regardless of what you put into it. And if you're not here living in Washington State, you get nothing. So it's a really great plan.
I have a comment or question.
Yeah. Hey, don't shoot the messenger. I'm just here, just give me the facts here. Yeah.
Connor, this is Narda. I have a comment.
Where are we here?
I'm not present. I'm on the TV thing or whatever.
Is this the net?
Narda.
No. Well, he's on the. Yeah. Go ahead.
Did you want Danette to go?
Meredith. Okay. Yeah. Narda.
Okay. So speaking from personal experience, I've seen the benefits of having long-term care insurance. And, initially when we learned about this, and now I'm explaining this to my business clients, it's something to give a really serious consideration for. To be able to preserve some wealth that, if you're going to resort to, if you don't have some kind of long-term care in place, and you have to resort to, say, Medicare kicking in, you're going to end up, all of your wealth is going to be taken away before Medicare kicks in. So there is some credence, and I love that your statement of saying, I love the spirit of it. It's got some pitfalls, but it really makes people think. If you don't have long-term care insurance, you need to give it a serious thought if you want to preserve your wealth in the long term.
Yeah, that's a great point. And like I said earlier, the private long-term care insurance is going to make a much larger impact for those that have something to lose, right? If we've got significant retirement savings, other liquid assets or non-liquid assets that would otherwise have to be sold off to cover those expensive costs of long-term care, like I mentioned before, having some kind of additional layer of protection would be worth considering. And the Washington State Long-Term Care Plan, the way I see it, isn't enough to make a big enough financial impact that says, hey, I want that. That's enough coverage for me. Now, if you're lower income, don't really have much to lose, it can be a great program for you. Offer some assistance that Medicaid and Medicare cannot provide. But for most of us probably in this room that have some type of savings, investments, other net worth, and will be using that for income outside of Social Security, that's where, to Narda's point, that you should take more of a serious look at if it's a good fit for you. Other questions?
Yeah, actually, I'm glad that Narda said something nice, because I was just getting ready to apologize for inviting you here. It's not his fault that Emperor Inslee passed. I'm sorry, Governor Inslee passed this. But a question with this though, do you know what the average stay at a long-term care is? Isn't it like a year and a half?
The average stay?
Yeah.
It depends on if you're male or female. Females tend to have longer stays than males. For us, we get sick, and our stays are usually, and we pass away, we die. Yeah. And we pass away relatively quickly compared to females. So the average stay for, gosh, I looked at these stats beforehand. I'd hate to miss. Do you know that? Yeah. 2.5 years is about the average. That was what yeah.
Okay.
It's about 2.5 years. But for males, I'd say that's going to be closer to 1.5 to 2. Females a little bit longer than that, 3.5. Yeah.
Sure. Yeah. And so, had a question too, or one question off that, and another one from that. This is covering 3 months, but the stay is anywhere from 1.5 years to 2.5 years. Is this? I don't recall, but maybe I just listened to the wrong voices of the state educating people about that before this was passed. And I might be wrong there. And then the other question is, are they able to use this for in-home care, to where they don't actually need to go into a stay-at facility? They just need someone to come to their house for a couple of hours a day.
Yeah, I'll answer that last question first. The coverage for Washington State, I believe, would cover really any of those needs. So if you need to go to a care facility, it would cover that. If you need some in-home care, it would cover that. Of course, there's those lifetime benefit maximums. Your second question, which was about how did this law get passed in the first place, right? Did we vote on this?
Well, I guess I was just wondering, because you guys stay really up to date on this. Do the people who are wanting this benefit, voted, obviously enough people voted to pass it. Was a message conveyed that, hey, this is a supplement to it? It's not. It doesn't take care of it. It takes care of 3 months out of a 1.5 years to 2.5 years.
Yeah, I look at this benefit as like another social program that goes hand in hand with Medicaid, something that's going to help our lower income families in Washington. And I don't think this was anything that we voted on. I think it just got pushed through. John, is that? Yeah, I don't think we voted on this. This just got passed through legislation back in 2019. I mean, I don't remember voting on it on the voters pamphlet. So yeah, it's really not going to cover a ton, but the spirit of it, the reason why they implemented this in the first place was that there's a lot of people that need ongoing care. There isn't any money covering that care. And again, this is going to be your lower income, what we consider maybe destitute individuals that don't have their own resources to cover that care on their own. So that's where this kind of social plan is going to come in and help cover some of those costs. So hopefully that helps a little bit.
Yeah, thank you. Appreciate it.
Yeah, no problem. In the back.
We can't hear you.
Okay, sorry about that. So my question is, does it cover, what if I'm already set up for retirement? I already have, all that and I'm that long-term. Can you do both? Is there a law you can't do a personal one and the state one or?
Yeah,
what?
good question. So you, if you wanted to continue to stay in, I mean, Washington State's going to be very happy to take your tax dollars. They're not going to, you could potentially do both if you wanted to. If someone wanted that additional coverage through the state, great. I don't see a reason why they would if they had their own private plan that would offer a bigger benefit. But good question. Yeah.
Real quick, not a question, just a comment, not joking. You do a phenomenal job of delivering somewhat crappy news. So
Thank you.
I'm just saying that really, you're sharing crappy news to a tough crowd. So good job.
Yeah, appreciate that.
I'm not going to say anything about the estate plan, but I am going to advocate for some kind of plans for long-term care. You know, my dad passed away in March, and I don't remember exactly how long he was in assisted living, but he surprised me 3 or 4 years ago when he said, you know, I have a long-term care plan, and I think I'm at a point where I need some help. And so he was able to move into a first-rate facility. I had no idea he had that coverage. He was able, but you know, as a survivor, as a son, you know, boy, that was great news because he moved into a first-rate facility and first-rate care, which is what any of us would want for our parents. And, you know, if any of us end up in that situation, we certainly don't want our survivors, our kids to have to help foot the bill. This is something to think about very seriously because there's a pretty good chance you're going to end up needing that at some point. And there's a big difference between retirement and long-term care. You might plan for your retirement, planning for long-term care is another story. But anyway, I'm a strong advocate for making plans of one type or another for that possibility later on in your life.
Yeah, good point.
So I have a lot of younger employees
Yeah.
that are already paying for their family act care, their family leave.
Oh, yeah.
So the way I understand it, so I can explain it, is that you can't opt out of this unless you have
Your own plan.
your own plan, and a youngster in their 20s is probably not going to have their own plan.
To be completely honest, this is the last conversation I'm having with people or want to have this conversation with people of my age.
Yeah.
I am having that conversation because it is going to make a financial impact on their plan. And like I said earlier, getting your own long-term care plan at any age needs to be a good financial fit. It just needs to make sense. Now, for somebody that, you know, younger individual, you know, maybe just they're happy that they can make their own bills and they don't have a lot of extra cash flow, maybe long-term care planning isn't the priority number one at that point.
And the way I'm understanding it also is that employers do not have to match this. This is strictly taken from the
That's correct.
employee's compensation.
Yep, this isn't an
Okay.
employer tax, this is an employee tax. Good point. Yep.
So Connor, will this cover splishy and splashy on the duck crawl?
Sure.
It did say something about being able to use the bathroom on your own, that type of stuff.
Yeah, if they need some ongoing assistance to toileting, yeah. Yeah. If they, at the end of the day, if they can't, you know, eat on their own or go to the bathroom on their own or walk about on their own, then potentially, yeah, this could help them out. Now, remember, it's long-term. So if this is only just kind of like a one-night thing, maybe not. So long-term would be after 90 days, usually. Yeah, that'd be a pretty bad hangover if that was lasted 90 days.
Perfect. We're out of time, unfortunately. Thank you so much,
No
Connor.
problem. Yeah.
So I'm going to just close. So June is Rotary Fellowship Month, and what a better way to celebrate fellowship than last week. So everybody have a good week.